By listening to this podcast, you agree to not use this podcast as medical advice to treat any medical condition in yourself or others, including, but not limited to, patients that you are treating. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast. Under no circumstances shall any guests or contributors to the podcast or any employees, associates, or affiliates of the Neuroendocrine Cancer Awareness Network be responsible for damages arising from use of this podcast. Welcome, everybody, to another edition of Nets Get Real with NCAN, where we share journeys. We share journeys of neuroendocrine and Nets. Today, we have Noura Dakka, who is a patient and a journalist, and very excited to talk to her about her journey. But first, got to get a little housekeeping out of the way. First off, don't forget our first conference of the year is in San Diego, California, Holiday Inn, San Diego Bayside. It's on February 17th. For more information, go over to netcancerawareness.org or to our social medias at netcanceraware. We are going to be hitting a number of other places this year, including Miami, Iowa, New Orleans, and Nashville. So for all that information, go over to netcancerawareness.org. So without further ado, I'd like to bring our guest on, Nora. Hi, how are you?
Hi, I'm good. How are you? Thank you for having me.
Yeah, no, thank you for joining us. Thank you for agreeing to share your story. So yeah, just give us a little bit of a background about yourself and what you do personally.
Sure. So, my name is Nora, as you introduced me. I'm 27 right now. I went to school for journalism and digital media, but currently I'm just working with humanitarian organizations like the International Rescue Committee and community engagement. Um, so basically, I got diagnosed with carcinoid lung cancer at the age of 20 back in 2016. And I've had it since then. It hasn't gone away, and I'm still in treatment. And the reason why I wanted to come onto the show is in order to share my journey. Maybe someone would find it relatable. And also, I have a lot of tips and resources for anyone who just recently diagnosed or has been diagnosed. And I feel like it would be very helpful for them.
Yeah, yeah. 20 is a young age, and I think a lot of people, the big misconception is, people are like, oh, well, you don't get diagnosed that young. So tell me a little bit about how you were diagnosed and what you experienced during your diagnosis.
Yeah, so also another big misconception is that only smokers get lung cancer, and I had never been a smoker in my life, and I'm Middle Eastern, and I don't even smoke hookah. So when I got diagnosed with lung cancer, it was a big shocker, and when I told people, they're like, "Oh my God, were you a heavy smoker?" Actually, I wasn't. I was really healthy. I had honestly just been normal all my life, and I had it all my life, and nobody even knew. Um, so how I got diagnosed was a really crazy situation because um so for about like 9 months I was experiencing very weird symptoms like extreme fatigue. I was having like night flashes, like night hot flashes. Um there was a point where I was also spitting up like clumps of blood.
Mm.
um, so I went and saw my primary. They only tested me for like the flu at first, and I don't know how you would see clumps of blood and think flu, but I guess no one would think 20-year-old cancer as well. So, um, but my symptoms didn't go away after, being put on some antibiotics or whatever. So they also ended up testing me for tuberculosis, bronchitis, came out negative. The doctor's like, okay, well, I guess you're just scratching your throat. And that went on for a while. Like the doctor just wasn't convinced anything was wrong with me.
Mm.
Um, which is something I want to talk about later on about how doctors don't believe something's wrong with you. Um, so about like maybe 9 months after having all these symptoms, I got really, really tired to the point I collapsed one day as I was out in the city in New York. I was out at a journalist convention, and my friends had to like drag me home. And then, so my parents were overseas, and my mom told me, "Why don't you ask your doctor to just get like an X-ray for your chest and make sure that everything's okay?" And I was like, all right, I guess I'll do that. So I got an X-ray literally the next day. I requested it from my doctor, and he was like, okay, let's just make sure your chest is okay since there's blood. Um, and the next day, the results came out showing a very big mass in my left lung. So crazy story. The day my result came out, which was literally the next day, my doctor went on vacation. So, my mom was freaking out when she read the results over the phone, and she immediately told me to go to the emergency room. They saw my results in the X-ray, and they immediately admitted me. About 24 hours in the ER while they were doing tests, blood work, another X-ray, and then I also did a CT scan. They decided to actually admit me into the hospital. At the time, I was 20, but for some reason, they put me in the pediatrics department, which is a very weird experience to be 20 and then
Yeah.
you're in the cancer pediatrics department.
Mm.
Yeah. But it was the nurses were really nice. I was like the oldest one there. So the next morning, my results came out, and as you could guess, it was a tumor. It was cancer. My doctors were very surprised because the tumor was very big. It was about 3/4 of my lung. Yes. So they're like, how did this go undiagnosed for so long? Um, what the next step was, they had to take a biopsy in order to diagnose me properly with which kind of cancer I had. So at that time, I was at St. Joseph Hospital in Paterson, New Jersey. The doctor took a biopsy. I also sent that biopsy to CHOPS in Pennsylvania, um, the Children's Hospital, in order to get a second opinion on that diagnosis, because sometimes you do get misdiagnosed. However, the results were um, the same, and it was carcinoid lung cancer, which is
Yes.
neuroendocrine cancer. Um, so according to the results, my tumor was really big, and it was basically like choking me to death because like I said, I was like spitting up blood, and it had to be removed. So about a month later after my diagnosis, I had my left lung lobectomy, where they removed about 2 lobes of my left lung. So I'm left with just the upper lobe. And then after that, it was really tricky to find the right treatment for me because, according to more scans that I had gotten done, like with PET scans and with gallium, which is very
Hmm.
important if you have neuroendocrine, especially carcinoid, to get gallium in your PET scans because that's the type of contrast that actually can detect it. It showed that my cancer had spread to my bones. And at the time, since I was here in the States studying, I had to go back home. I'm from Lebanon, and I couldn't really get my treatment done here because I didn't really have a place to stay. I was just a student. Um, and I needed my family around me. So we went back to Lebanon, and I saw a lot of doctors. And even my case was sent to France in order for a group of doctors there to also study my case to find out what's the best treatment for me. So I started out with taking um, like chemo pills at first, and that was a disaster.
Yeah.
I feel like doctors don't really explain to you what you're going to be facing when you're taking these treatments. They tell you that it's going to be just fatigue and maybe a little bit of nausea, but it's really more harsh than that, and I feel like they're scared to tell you so that you don't get scared to take the treatment. But I'd rather be told what I'm going through in order
Yeah.
to get myself like mentally ready. So I started on chemo pills, and I'm not gonna lie, I almost died on the chemo pills. They were not suitable for my cancer at all. Um, my body rejected it completely. There were days where I was just literally just flesh on the ground. I couldn't move, I couldn't speak, I was dying, and just literally throwing up my insides. So we went on to the next step of treatment. I went to a better doctor. He is a doctor in the American University in Beirut. He is a specialist in lung cancer, and he suggested we get started with octreotide, also known as sandostatin. And this is important because this is the treatment, the right treatment for my type of cancer. And he told me that I have to stay on this treatment. It's just an injection that I take every month for the rest of my life, and I cannot stop it. I started on that treatment immediately. It was also very difficult because you're introducing new stuff to your body.
Yeah.
So my body also rejected it. And I like literally passed out. My body did not like the medication at all. It was a very low dose, but I
Mm.
guess just like I said, you're introducing this new chemical to your body. It didn't sit right with me, and I struggled a lot in order to get used to it. Like your body has to get used to this new treatment.
Yeah.
So I kept rejecting it for a while until I finally stabilized and I was able to like not have any weird symptoms like fainting, hot flashes, nausea. I finally adjusted to it. But then you get to a point where you start wondering, like, is there more I can do? Like, I don't just want it to just be there, because I had to take this medication all my life, and my doctor said that it wouldn't, like, my cancer wouldn't go away. So I started wondering, like, is there maybe another treatment I can do that would shrink the tumors and make them go away instead of having these tumors for the rest of my life? And then I started seeing more doctors and getting second and third and fourth opinions, which I think is a good idea and a bad idea at the same time because now you get conflicted when you get all these different opinions,
Sure.
especially when you're diagnosed with like a rare tumor. Um, so while we were getting different opinions from doctors, another weird, wild thing happened to me. In my right eye, I wasn't able to see clearly anymore. And I usually wear like glasses or contact lenses, so I just thought I needed a new prescription. I went to the eye doctor, and the eye doctor was like taken aback. He's like, "There's something in your eye, and it looks like liquid." And I'm like, "What do you mean?" This is like, why would there be liquid in my eye? I'm like, he's like, "I don't know, but something is like leaking liquid into your eye, and we need a closer look." So I was sent to a specialist, like uh, a, a specialist for the retina, and they did even more thorough tests, and the cancer had spread to my eye. Yes, so it's like a series of very weird diagnosis one after the other. So is the lung, then the bone, and now my eye. So the only treatment for your eye is to do radiation. Um, However, I was very lucky. My family and friends, and even the people from my town back at home, set up a GoFundMe, a local GoFundMe. People funded my radiation, which is I'm very grateful for, and community is very important. And I was able to get radiation at a John Hopkins affiliated hospital in Beirut. I did 15 sessions of radiation, and thankfully, there was 3 little tumors that were leaking in my right eye. They went away after 15 radiation sessions, which is great, and I'm very grateful for that. And I regained sight in my eye. Um, After I finished with that, crazy journey, I'm telling you, it's like a roller coaster. We continued looking for a doctor who would probably have a solution for all the tumors that were in my body because I forgot to mention that I removed the big tumor in my left lung, but my right lung had little tumorlets like spread out.
Mhm.
And also it spread into my bones in multiple places. So we were trying to find a solution. Is there something we can do to decrease them or maybe like find a way or treatment to get rid of them. It's hard to live with something that hurts, because bone cancer is pretty painful. I found a good reputable cancer doctor who said we can try two different chemo, like intravenous chemos. um I remember correctly, this was a while ago. Like I said, I was diagnosed like 7 years ago. So it was called cisplatin and Gemzar, the two intravenous chemos that I took. Whew. Let me tell you guys, I have become the most anti-chemo person you could ever meet. Like, I went on those treatments for about 3 months, 2 months or 3 months. It was like 10 sessions. And I literally believe my soul left my body
Wow.
and came back. It was very difficult. It's especially since today's modern medicine doesn't look at you as a human. They look at you as just another case number that they're trying to treat. But what really is treating in when it comes to cancer patients? Because they could come to you and say, I have a trial, it's very promising. But what does that mean? Does that mean that you're going to get better? Does that mean it's curable? See, they use these terms to like encourage you to try their trials and their chemos and stuff, but it doesn't really say the truth. This is like my opinion. When my doctor says this medication is tolerable, but by whom is it tolerable? You know what I mean? When your doctor says, oh, there's a new trial we want to put you on, you need to explain to the patient what that means. It doesn't mean it's a cure. It doesn't actually mean it's a treatment. It doesn't mean you're going to consistently be on this until it's gone. Trials mean, literally from the word, they're trying it on you. Like you're their guinea pig. I know this sounds negative, but it's very important for cancer doctors to explain this to patients according to my experience, because this wasn't explained to me. Um, I was just told promising or tolerable, and I really hate those words, because what does that mean for me? It could be tolerable for you, Mike, because your
Yeah.
body's different than mine, but it doesn't mean that my body would tolerate it. And as you guys could see from my previous treatments, my body didn't tolerate anything. It literally rejected most of the treatments that I was put on, um, except the sandostatin, which took time to adjust to. So I went on these chemo treatments, and it didn't work. It actually manipulated my tumors, and they grew a little.
Mm.
Tumors didn't like it. They have a mind of their own. They want to
Yeah.
be their own person. So they grew a little. And after about 10 treatments, I sat down between myself and I said, okay, listen, you could either keep going on all these different treatments and tire your body out to the point where it can't take care of itself anymore, or you have to make a decision and find out where what you can do where you're able to stay alive and stand on your own 2 feet. Because I consider myself, I died 3 times. Each treatment I tried, I feel like literally my soul left my body and came back. It was very difficult. I didn't, Younger patients don't have like the right AYA programs to help like with group support and like mental health. So I also struggled with that. I didn't have anybody my age going through what I was going through. Usually in the cancer center, it was very much older people.
Right.
And they would sit and look at me like, oh my God, how do you have cancer? And it's just like, well, everybody can get cancer. It has nothing to do with age. Um, so I decided to stop chemo. I told my mom I want to like heal myself. I want to be able to be human again and walk on my own 2 feet and just like breathe. Like if I'm gonna die of cancer, I'd rather die comfortable than to die this way. So my mom agreed with me and we stopped the chemo. and I detoxed my body for a while. Something about chemo, they also don't tell you there are long-term side effects that don't go away. Um, Chemo caused like some deterioration in my bones. I have osteoporosis. It's very painful in my shoulders and my elbow. And I did a lot of physical therapy for that in order also to regain mobility because
Right.
chemotherapy caused my bones to like literally fall apart. So let's fast forward a little bit because I did end up leaving Lebanon to come back to the US to finish my studies because I decided, okay, I want to live now. After about 3 months going back to the US to finish my studies, I collapsed again. My tumors were growing. They were growing slowly, but they were growing. So we had to find a solution because if I do want to continue this way, I can't also keep collapsing. Um, so I found a doctor who specializes in carcinoid cancer in Holy Name Hospital here in New Jersey, where I live currently.
Hmm.
He suggested same thing that the doctor in the American University in Beirut suggested, which was to take the sandostatin octreotide every month, and that should be able to just you know shrink the tumors or at least stop them from growing, and also it would help with your symptoms, which I was having, like I said, hot flashes. I would faint, always nauseous, I was fatigued. So I went back on the sandostatin treatment, and I was there for a couple of months. I'm going to admit I'm not a very good patient. I'm not consistent. I get cold feet easily, especially when a doctor doesn't listen to my needs. One day, this doctor told me there's a very promising trial that I want to put you on. And I explained to him, I said, okay, that sounds great, but I decided I don't want to do trials and I'm okay with staying on the sandostatin until I'm okay. Like, or until my time has come, it's fine. Because I feel good. I'm better. I'm able to walk on my own 2 feet. I go to school. I go out. I have a life again. And he's like, no, please try it. Like, it's really good. And the statistics show it's, like I said, promising. And I was like, okay, well, what are the side effects to this trial? It's an immunotherapy. He's like, immunotherapy is very easy. It doesn't do anything. It's intravenous and mostly you'll get just fatigue. Gives me a brochure. This is why I stress so much about why doctors really need to explain to their patients what they're going through. He gives me a brochure, excuse me, that explains everything that immunotherapy will do to your body, like the side effects, and it was evident that it will have the same side effects as chemo.
Hmm.
I don't want that. I don't want to put my body through that. I feel better. I'm good. And my doctor's like, okay, think about it. We'll talk about it next appointment. Next appointment, I come, and he had already set up like the immunotherapy for me, even though I originally said I didn't want to do it. And he tried to pressure me into staying and doing the immunotherapy. And this is where I got really iffy about this doctor because if my doctor doesn't listen to my concerns and how I'm feeling, then I don't want to work with this doctor. Even if like he's known to be maybe one of the best doctors in the US or even in the world, if he's not listening to your concerns and how you feel,
Mm-mm.
you should really consider finding a new doctor. Um so I let that pass, honestly, Mike, and I was like, you know what? I'll give him the benefit of the doubt. Maybe he's just looking out for me. He's my doctor. Next appointment comes up when I come in to take my injection for the sandostatin. He does the same thing. He brings me into the room where the immunotherapy is set up. And I look at him like, Doctor, we had this conversation and I told you I don't want to be on any type of treatment. I'm okay with the sandostatin that I'm taking. And also, I don't feel comfortable with you running it through my insurance, even though I told you I don't want to be on it. Again, this is very promising. It's a great trial. But I don't want to be on trials. I don't want to be tried on. And he didn't get it. So I know I was with him for maybe about 6 months until I decided to run away.
Yeah.
I looked for a new doctor again. And as you can see, like it's a long list of doctors who I don't blame, but at the same time I do, who didn't quite understand how to treat with what I had, and also doctors who weren't looking at what I needed. I found a doctor at Hackensack Hospital. He specializes in lung cancer, but not carcinoid, because it's very hard to find a doctor that specializes in carcinoid.
Yeah.
And also insurance as well plays a big role in what kind of doctor you can go to. Um, this doctor did not fit me as well. I don't like being, like I said, being treated like I'm just another case study. Like, comes in rushing, let's go. All right, here's your treatment. All right, bye. I expressed many concerns to him, didn't take any consideration into it. And I was like, you know what? All right. I've been through so many doctors. One more doctor. And I'm gonna like just let it go and not see any more doctors. I was about to give up, honestly. I told my mom, like, if I'm gonna look for one more doctor. If this one more doctor doesn't listen to me and my concerns, I'm just not gonna see anybody anymore. Because, like I mentioned, I want to be healthy. I want to walk on my own 2 feet. I just want to feel human. I don't want to be tired. And I'm sorry if I'm rambling. I know
No, no,
it's a
no.
long.
This is all important. This is all very important, and you know, something that I definitely want to talk about too is you know, something that we talk about at our conferences and stuff like that is, and sometimes it's jarring for people to hear, but if you don't feel comfortable with your doctor, if your doctor isn't making you feel like you're on the right path,
Mhm.
then yeah, it is time to get in to speak to another doctor. It's okay to fire your doctor if you his treatment plan is not fitting your needs. And I the importance of seeing, I think the takeaway here is you got to see a specialist. I think a specialist is paramount to you know, treating neuroendocrine and stuff. And you know, when you go to a cancer doctor, I do think that they kind of get, okay, this is this type of cancer and this is what we give it.
Mhm.
Whereas neuroendocrine, there is there is no cookie cutter treatment. There's so many things. So to get a specialist and then also a local you know, just a local doctor that's willing to work with your specialist on your specific case. But everybody is a very unique case when it comes to neuroendocrine, and I don't think many doctors understand that, especially just you know, especially like cancer specialist doctors that are not specialists in this. But yeah, we see it all the time. We see it all the time with people being misdiagnosed and being told, you know, I said it on the last episode. My mother and father were in a very well-known doctor's office, sitting in his office after a myriad of tests and stuff like that, and they're holding hands, and he said, "Mr. and Mrs. Wayman, I'm going to be honest with you. I think you've got a bad marriage or something," and that was his diagnosis. And it's rough. It's rough getting to the right doctor. But I hope you're getting to where you found somebody for you.
Yeah, so I do want to stress, don't hesitate if you're not comfortable. Like, just don't think about it. If you're not comfortable with your doctor, don't feel bad. There's so many doctors out there. There's so many doctors who probably know more than your doctor. And it's not bad to like get second and third opinions if you're not feeling it. I feel like some people are just scared, like what if I leave this doctor and I don't, have like they don't have the same treat. Okay, it's okay not to have the same treatment plan because like you said, not everyone diagnosed the same cancer gets the same treatment plan. That's okay. You just have to find that doctor that knows how your body functions and does the right tests and listen to your needs in order to find the right treatment for you.
Absolutely.
Yes. So, last resort for me, and finally, this is after many attempts with my insurance to get Medicare for disability. That's on people on disability. I was able to see a doctor in Memorial Sloan Kettering. And this doctor, unlike all my other doctors, was a female. All my previous doctors were males. So this female doctor, Memorial Sloan Kettering, I'm happy to say I've been very consistent with her. She's been very consistent with me. She listens to my needs. She's on top of everything with me. She started a new slate when I came to her. She's like, let's start all over. Like, I'm just meeting you for the first time and you don't have a record. We did scans. She took my old sample from my lung that they took out to test it again, make sure that the diagnosis was correct. And ever since I started with her, I feel very comfortable. I'm able to express myself and tell her what I like, what I don't like, what's bothering me, what's not bothering me. Um, I'm scared, I'm not scared. She also helped me find a good therapist that I'm able to talk to. I haven't talked to anyone for like 7 years. This is not something that I was easily able to express. I had a lot of close friends that didn't even know I was going through this. It's just something I didn't know how to talk about. So she also introduced me to the AYA program that Memorial Sloan has, and I really stress and encourage young cancer patients to join AYA programs. It's very important to find somebody who you could sit with and talk to and express what you're going through and find that person relatable. Because your family could be the best support ever,
Mm-hmm.
okay? But like they're not gonna get it. They're not gonna understand you look good but you're tired. You could hike today but you're mentally not there. You you took your medication. I mean, it didn't give you side effects, but you're just mentally down, you know? I feel like other cancer patients will understand you more because they've been through it and they're
Sure.
your age. So AYA programs is very important and I really think that we should have more of them.
I agree, and it's funny we're kind of turning this corner where in the world it's a little bit more a little bit more aware of mental health and whatnot, but I think in the neuroendocrine world as well, and we've been hitting on that a lot. Just it's very important to get that outside opinion, like you said. Your family can be the most supportive people ever, but at the same time, sometimes you need that objective. There's no context. There's too much context with family, whereas with a therapist or somebody else like an AYA member, like you don't get all that extra context as well, and you can get a more objective opinion and kind of advice, and I think that's great. I really think that's super important, and I agree with you. I agree that we gotta push a little bit more on that mental health aspect of things. Something I did want to ask you too is like in your time as a patient, what is like for a new patient, what is your like number one tip to them to navigate the waters of neck cancer?
Um it's going to be difficult no matter what you do. It's not easy to be diagnosed so young with something so rare or even not rare, even like a very common cancer because cancers are aggressive and it's the treatment for it is hard. It's not there's in my experience, if I could go back in time and change what I did, I would speak out more. I really isolated myself when I got diagnosed. I didn't really express how I was feeling, physically and mentally. Um, my family and my friends were very supportive, but I didn't express to them that today I feel like today I just want to die. I don't want to get out of bed. You know what I mean?
Mm-hmm.
all these things that I was going through mentally did not express to anybody. I didn't ask for help. All these resources that I know now came to me like later on. If I had them in the beginning, maybe my journey would have been a little bit more easier for me mentally, and psychologically. So I would just advise them to like not be afraid to ask for help and like actually express what you're feeling and talk to your doctor. Your cancer center should have resources for like a therapist or programs that could help you, cope with what you're going through. Because
Sure.
like I said, you could sit and explain to your sister like what you're going through, but she's not going to get it because she didn't go through the chemo. But when you sit with someone who went through the chemo that you went through, it's more relatable and you'll feel more comfortable that there are other people out there my age who are going through this and it's just not me.
Absolutely. Absolutely. Um, just before we wrap up here, when it comes to proper care for a patient, what is the most important decision a new patient can make?
Proper care comes with how you and your doctor connect. You have to have a comfortable and safe space with your doctor. And that's what I struggle with, as you could see. And you shouldn't shy away from asking questions. Like, what about this? What about that? What about if you go home and do your own research, which is great, you should go home and do your own research on something your doctor wants to put you on or a new diagnosis that you're on, and you find like all these tons of questions, bring them to your doctor the next day. Don't be afraid to ask them 10, 20, 30 questions. This is your body.
Yeah,
You're introducing new things to your body, and you have the right to ask these questions. And it'll also help you make your decision. Like, if you want to go on this treatment, if you want to continue with this doctor, it's very important to be comfortable and be able to talk with your doctor and feel like there's a back and forth.
absolutely. Absolutely. Nora, thank you so much for joining us and sharing your story. It was really great to, it's very important that people also hear young people's stories, because this does not just affect older people. It affects younger people as well. So I'm really happy that you're feeling comfortable today and you're feeling comfortable with what you're doing moving forward. You found somebody. Everybody, please head over to netcancerawareness.org if you want to get involved in any of the programs we have coming up. We have quarterly live streams, Q&As with doctors and professionals from the NET community. Of course, we have our conference coming up February 17th in San Diego, California. And then if that's a little too far for you, we're probably coming to an area near you. Go to netcancerawareness.org for more. And thank you guys for being on Nets Get Real, and we'll see you next time.